1 in 8 women will be affected by breast cancer, and I was diagnosed almost exactly 1 year ago. It's prevalent enough that I have 18 members of my staff. I actually, within 6 weeks of my diagnosis, one of my technicians was diagnosed because she was 7 months overdue from getting her mammogram, had a family history. She's exactly my age. She went, caught it very early, which is wonderful. So out of my not so early catch came something very positive, a much easier path for her. But it's certainly one of those things where I think statistically we often think it's going to happen to someone else. That's human nature. And I look at our profession and I do wonder what the rate, if there's a higher rate within certain professions too. I also experienced a lot of fertility issues. There are higher issues of infertility in veterinary medicine as well. We're exposed in our daily work to many carcinogens, anesthetic gases, and a lot of those things have been linked to it. There was a recent JAVMA commentary actually about that, reproductive hazards. So it's been quite the journey. I think I've been in denial for most of it because I'm busy and I just have to keep making life and my work happen while going through treatment. I've pretty much been a comfortable person to live out loud, and it is what it is, and I don't mind if people ask questions or want too much information. I'm willing to share, but I think it would be hard to hide those things because especially once you go through chemotherapy, you physically look different. That's when you go from you just had a lump in a breast to I look like a cancer patient. I certainly understand when people do want to keep things very private and if they have a way to do it. But once you have no hair, if you're a woman wearing any kind of cap or wig, it's pretty obvious and there's going to be questions. I think that's another thing I've really realized. I've always felt like how we deal with veterinary medicine is very individualized. Much of what we do has to work for that client with their pet at that time in their life for their situation on multiple levels. And it's the same thing when you go through anything major medical. It's very personal and it's very different. So even though there might be a huge club of us out there in veterinary medicine who experience breast cancer, it's going to be different for every single one of us. I have much more empathy and sympathy for my patients who will go through chemotherapy and major surgeries, and my clients, because obviously I have clients come in who have cancer touch their lives. I truly know how they feel. I know what it feels like to lose all my hair and eyebrows now and get chemo curl and wear wigs, and it has become a real touchstone with a lot of my clients. We're a small community. Many of my clients know that I've had breast cancer because the staff has had to reschedule appointments if I had an urgent appointment or was too sick to work. So working around that, I have clients checking in on how I am, which is wonderful. It's actually connected them to the clinic. And my star technician, who also has been going through the process pretty close to mine, they've been checking in on her. So if anything, they've had more bonding with us over it as well, and I hope more awareness. And we have a lot of females in our veterinary staffs. We should really encourage as much wellness and health screening as we can in areas of things like getting mammograms at the right age, to be proactive.
Meow.